so we can't be afraid when it's time to unsocial distance ourselves, but we have to be careful about it.
So what can we do? Just
So that's kind of what I'm, sort of seeing from this week's headlines in my head. But what we can do is take care of our pre-existing conditions. So let's take care of those. So what's the biggest pre-existing condition? Obesity. After age, obesity was the leading cause of death in New York City so far, in this pandemic. So we've got that, something we can do something about. We've got uh, hypertension, most likely caused by obesity. We've got diabetes, most likely caused by obesity. So those are I mean, pulmonary disease. Yes, we should all stop smoking, and the difference is with pulmonary disease, the older people with pulmonary disease had it when smoking was acceptable. So many young people aren't going to have this pulmonary. Younger people aren't going to have. I mean, you and I mean, I never smoked. I'm sure you never did, or maybe a little, who knows? But like our generation was really the first generation to be like, no, we're not smoking. You know what I mean? So we're not going to have that pulmonary issue later in life that older people will, or a lot of us won't.
what about
But
vaping? Like you
I'm
said,
sorry.
what about the whole vaping? I mean, people shouldn't be vaping now. They should find a way to stop that. Correct?
No, people should not be vaping right now. They shouldn't be smoking right now. They shouldn't be doing things that alleviate, that injure their lungs. And yes, they're asthmatics, but I have to say, looking at all of the data that's come out so far, asthmatics have not really been, any worse off than anyone else.
Yeah.
Not good, so far. So we have to kind of, just think about what we can do to ourselves for ourselves. And that's what I've been seeing in my patients. Okay, let's get back to taking care of my diabetes. Let's get back to taking care of my heart disease. Let's start engaging again. Because if this is the way we're going to have to engage, by Zoom, by, slowly, half the restaurant being full, half the gym being full, if that's the way we're going to have to play this game, let's start taking care of ourselves so that we're prepared to play this game. I don't want to not go to the beach this summer.
Oh, I'll freak out.
I think all of us are going to freak out. You know what I mean? So I think it's really time that we get ourselves, usually this time of the year, what am I talking about? Getting yourself bikini ready for Memorial Day.
Yes.
Well, Memorial Day is 4 weeks from now.
No, you're freaking me out even more.
Maybe 5, but it's like, it's a month from now.
It's here. It's coming. You need to get yourself in gear. And
Didn't know this morning, but like, I was walking the dog and it was snowing. I'm like, what's this all about?
that's a whole other, I don't know, phenomenon going on right now.
The world is coming to an end.
Yeah, but that being said, before it does, I'd like to get myself situated and ready. And everyone I'm talking to is like the COVID-19. Forget about 19. Very rarely am I speaking to people that haven't put on weight during this pandemic. If somebody tells me, "Oh, I've dropped weight," I'm like, "What?" It's So we really, I don't think people know how to get back on track, and I think that's what's great that we're here today. We're going through all this, and I think that us checking in and reminding people, get back on track, get that routine going, and here are the tools. Here's a way, or call me. I'm here for you, because people need that. If you don't know how to get back on track, you don't know who to reach out and call, you have no idea who's available out there. There's been so many people that have been so upset where their doctors are unreachable. I'm not talking about the ones in the hospital on the front lines. I'm talking about the ones who've been in the office. You receive your calls and your messages, right? Like if somebody
every minute, like I'm like too much.
You're blowing up right now. I know. No, but I think people want to start establishing that familiar face and what's available, and you're giving us that, which I think is key and important.
And I really do want people to understand what's available to them, right? There is so many mental health services available to us for free now. There's so many things available that the city and states are providing for all of us that I think, take advantage of some of it. This is, for most people, this is not something that they've ever experienced before. So it would be nice to be able to learn how to express that so that we are able to have very real conversations about what's going on with ourselves and with our family and our loved ones so that we can sort of process this. And it's been, I was speaking to a friend in Los Angeles last night, and we were talking about how it's really been a good time for self-reflection as well. Like, at least for both of us. I mean, we both had that same realization. Like yesterday, it just dawned on me, like how much more time I have, as busy as I am, and as complicated as it is to run a medical practice, not having all my tools at my disposal, or they're all in 14 different places, my tools. It's been a remarkable time that to actually really think about how it's affecting me, how is it making me feel? Like take 5 minutes and say, how is this making me feel? What is it bringing up for me? You know, for me, it brought up the first epidemic that I went through, which was the HIV epidemic. So it brought up all of that fear and I think that's what I was reacting to a few weeks ago was that panic with all those people coming into the hospital and not knowing how it's transmitted, not doing what you did. But you know what? Healthcare workers, that's what we do. We were in there on the front line doing it, putting our own health at risk half the time. And, just you get the job done. And I just want people to understand that if this were as virulent or as transmittable or as, it's not Ebola. If this was Ebola, we wouldn't be having this conversation right now because one or the other of us or both would be dead, right? So we have to look at it in perspective. Yes, it's a bad respiratory disease, but we're not going to know the extent of that for probably 6, 9, 12 months. We're just not going to know because we're not going to have the numbers to figure it out. Because just because we're testing you, and here's the problem with the testing, just because we're testing people who are sick or who think they're sick. So if I tested you today and you weren't sick, tomorrow you could be sick, but you would go down as a negative. You'd go down as somebody being not sick and who was tested.
Correct.
You know what I mean? So, and that's not to put fear into people. I just want people to understand
Reality.
the challenges and the reality of what we have to face right now. And so it's almost like, let's put our collective energies into what's going to help us really get out of this, which would be having an IgM antibody test that's available to all of us, to be able to really come together as a nation and realize that, yeah, maybe on this day I can't go to the restaurant, but tomorrow I can.
Correct.
And today you can go. And Americans don't like being told what to do and what not to do.
Yeah.
But I think we really need to look inside ourselves and take some time to sort of say, how am I going to respond to the challenge, which is moving forward from this? We all responded well to like staying home and, doing what we needed to do. Granted, we overreacted and, we now have more food in our houses than we need and more toilet paper and more everything else than we'll ever need, hopefully. Again, knock wood. So now it's now we're I think we're in phase 2. And we need to prepare. Now we need to get ourselves ready for we need to be in phase 2, experience phase 2, and then move to phase and be able to think about how is phase 3 going to accept that? How are we going to accept it? Anger is not going to be right. We can't, get angry. We can't get angry about the situation. We all want to go to the beach. We all want to go to a sports game. We all want to see, our favorite performers perform, live, in a concert live. We all love that experience.
The whole experience. It's all about experiences, right?
Right.
Not experiencing right now, but
we have to prepare ourselves to be able to experience. And we're not going to go from this to being back at Madison Square Garden with 70,000 people. We're not going to do that. That's not going to happen. So just know that that's not going to happen. And are we all angry about it? Sure. I'm like really annoyed, like really annoyed.
okay, but start focusing on yourself. Start focusing.
That's where it all begins with us, right?
And it begins and it's begun with you and joining us and walking us through all this. I mean, it's nice to have that familiar face and checking back in with you, knowing that there are things we can do. Because what from the message we've been getting up until now, it seems like there's nothing we can do. Just stay huddled up,
And
hide
hide.
under a blanket, panic, and don't do anything.
Right.
Across the board, that's what it's felt like. I mean, before speaking with you today, I mean, you gave us a different light, a nice light. Yes, they're still fighting in the hospitals on the front lines, but there's a calm. When it's calm there, it'll help calm us. And it's a step closer to getting a step back to who we were, step back to getting back to our new reality, right?
Yeah, or just, it's not, and I don't like the term new real, new,
You're
the
right.
new, what, the new normal. I don't like that at all, because what we're going to go into next is nowhere near what's going to be the new normal. It's another transition.
So
It's another transition phase.
you said it is phases. It's better to call it a phase. That is
Yeah.
a much healthier way to think about it, speak about it, and prepare for it.
Oh yeah, because if the new normal, we're never going to be able to gather again, and we're always going to have to wear masks and blah blah
Yeah,
blah.
that's panic.
Not the new normal. That's panicking still.
You're right.
This is what we're going to have to do. Let me look at Sweden, right? Sweden has done none of this. Their economy is 100% intact, and they took the message of socially distancing, and they don't have a worse death rate than Norway, which is their neighboring country that shut everything down. You know what I mean? So there is hope in the world, and there is a way of doing this and doing it responsibly. And so we can't be all, yes, it's sort of like it's grief, the phases of grief, like anger is the first one,
Right.
right? And then, and then you finally get to acceptance. But, so we have to phase, we all had our angry phase in. And whatever you have to do, if you have to talk to a therapist about that, if you need a punching bag, go buy order a punching bag, like do whatever you need to do, like do it.
My mind. I actually looked into getting one for home, and my daughter says, "Oh, mommy, can we please get one?" So that's hysterical that you even said that.
Yeah, I mean, take your aggression out somewhere, because we should. Like, we shouldn't hold or harbor our anger, but we shouldn't take it out on each other. We shouldn't take it out on the people we see on the street. We shouldn't do that. We should learn how to channel our anger. And then now we'll move to the next phase. And when we get to the next phase, I'm sure there'll be something we'll be angry about there too. So because it's not what we want, right? We want to be able to walk out our door and have life be exactly what it was like 2 months ago. Not going to happen, but we can stop and smell the roses. Hate to use that expression, but we can. We could stop and say, okay, here's what I have, and this is good, right? This is good, and that's what we have to do.
It,
I know this has turned into a very sort of philosophical head thing, but I mean, I think it's really important that, we address this. I mean, we address that the fact that you can't separate the mind from the body. You can't separate health from our mind. And if our mind's not healthy, then we're not going to be healthy either.
so I mean, you hit it right on the nose. It's mind and body, and it's for your health, wellness, and lifestyle. Which is why we're talking about this, trying to get people real information, but also options. And also, I mean, I don't know, every time I speak to you and you kind of tell me, no, this is what's going on, it gives me a sense of calm that I'm able to share with my kids as well, with my husband as well, with my coworkers and colleagues, because everything else we're seeing is like panic. Like you don't want to talk, you don't want to watch the news, you don't want to watch TV anymore, because all you're seeing is like, it's depressing. I mean, and it shows like it's a cycle, like it's not changing. But I just to kind of tie everything together, it's great because, like you said, we're going through phases, and it's nice because when you're evolving, that means things are getting better. That there's hope and there's options, right?
There's always hope and there's always options, but that comes from you. That comes from inside of you. And if you're not willing to accept that, yeah, we're going to have to do a little, life's not going to be what I planned. What is that saying? What is that saying? God makes plans. No. Humans make plans and then God.
Humans dream, and God laughs when humans make dream, or something like that. When
Yeah,
man makes dreams, God laughs.
when man makes plans, God laughs.
Yeah.
That's what it is, I think.
I
Something like,
tell you in Greek, but no one else would understand because people say that all the time. So it's true.
but yeah, I mean, so life has, a course for us, and it's how we react to that is what makes us either angry, sad, depressed, taking out our anger in food instead of exercise. I mean, it's just because this has happened to all of us, we can't. Yes, it was fine to be angry at the beginning because why not? Like you change, I was not promised this. I was promised a rosy life till the day I died, right? Well, that's not true, but we would like to think that. But so now we have to look in ourselves and say, how can I be thankful for what I do have, and be ready and prepare myself for what comes next. So getting your health back in order, not forgetting about it. For me, that's what I'm seeing. So I'm just sort of reporting on what I'm seeing in my patient population. And if I'm seeing in my patients, I'm sure there are a lot of people also out there who are ready to go to that next step, who are ready to say, okay, this is what we have to deal with. And now I have to still live my life. I still and not be afraid. And I think that's really what I want my message to be is don't be afraid. We will still live our lives. It'll just look differently, and each phase is going to look differently. And we'll figure it out. We'll figure it out.
That was beautifully and perfectly said. On my last note for today, I wanted to ask, so let's say I wanted to get started. I want to, get back on track to get myself, my health and well-being. Are someone able to call as a new patient? Like, just to
Oh,
start things.
me?
Yes.
Absolutely. Absolutely. Yeah. Yeah. No, and you think about it, the office has all the, this is what life's going to be like, right? You have to come out. We have to take your temperature before you come in. You have to wash your hands before you come in the office. You have to be wearing a mask, all of those things. And so the office is up and running. I'm seeing patients all day long. Whether, starting next week, I will probably be in the office every day. It's just dependent on the weather for me because I live in Manhattan, don't have a car, so I have no way of getting around except walking. And this morning I was not going to walk to work in the snow. So luckily I could do it from here. Especially snow at the end of April, I wasn't going to walk through.
That was a crazy one.
So anyway, yeah, I think so anyway, the short answer to your question is yes, we are open, always accepting new patients. I want to be there to help people, and that's why I've stayed open throughout the whole time. That's why I answer emails 24/7, well, except when I'm sleeping, and
I'm surprised.
answer people text, that sort of thing. I'm here to help. I mean, that's my job. So I think if people want to get started, I'm happy to get started. I'm happy to help people walk through what they need to do, and sort of to just remember, and if people forget about my website, there's always tons of information there about how to do everything I talk to you about is all on my website. So I think that's a really good way. I'm sorry?
Before we end today, can you tell us your website?
Sure. It's dr like doctor drpescatore.com. You can sign up for my free newsletter. Comes to your inbox 4 times a week. So it's free e-newsletter. Lots of great information on there. And you could search the archives for anything that you're interested in. I have all these health protocols that you could sort of look up, like a sleep protocol, a cancer protocol, an Alzheimer's protocol, all sorts of different things. Like I have a longevity protocol coming out soon, and a stress protocol coming out soon. So
we have a lot to talk about in the future.
Always. I have so many things to talk about forever. I've been doing this for 30 years. I have a lot of information to talk about.
Thank you very much, Doc. I mean, thank God. Thank you for checking in with us today. Thank you for being there. And thank you for all the information. And thank you for reminding us to get back on a routine.
Well, thank you for allowing me the opportunity to speak to everybody. It's really, I think, really important. And I just love doing it. So let's keep doing it. Let's get this information out.